As a healthcare leader, do you believe in unmatched patient service? Do you envision a future where healthcare access is both universal and immediate? If you're not sure, it's time to shift your perspective on what the epicenter of healthcare looks like. Once, healthcare leaders focused on infrastructural prowess. Call centers were supportive, not transformative. They were essential, but were they game changers? However, with the dynamic landscape post COVID, our communication channels are transforming healthcare's future. Historically, the emphasis was superior healthcare can only be delivered face to face. Not anymore. With research showing that stellar patient service increases compliance by a significant margin, it's evident that patient interaction outside the practice walls is crucial. Imagine neglecting a platform that, when optimized, can improve outcomes by up to 30%. Tagging patient calls as mere transactions is more than a missed opportunity. Every call center representative stands at the forefront of doing well and doing good. This isn't just about individualized care. This is about smart business. When patients feel valued, when their concerns are swiftly addressed, we're looking at an increased patient lifetime value. A more engaged patient translates to continuity in care and higher revenue. This is not merely a healthcare strategy, it's a growth strategy. See, the new era measures care not just by clinical outcomes, but also by communication quality. A patient, whether a new mother or a senior citizen, should feel that immediate connection, understanding, and support. The goal? Ensuring that every patient interaction isn't just efficient, but also enriching. I've seen the skepticism. The doctors confidently say, "My patients trust me," and then question, can a call truly replace the human touch? But we're not talking about replacement. This is about strengthening your relationship through enhancement. The old debates about who owns the patient relationship all have one thing in common. They fail to recognize that the patient owns the relationship. Decades of research show that patient-centric communication strengthens patient trust, ensures consistency, and elevates compliance. I'm not saying it's easy. Staffing shortages are now the nation's top patient safety concern. The American Hospital Association has called the workforce shortage a national emergency. But what I am saying is that the old practices aren't working, and it's time to elevate the role of the call center staff. It's simple math. Better communication equals better compliance, which in turn boosts outcomes. As outcomes improve, revenue grows, benefiting both the institution and the patient. So in this channel, we'll review the research, we'll discuss best practices, and some of the posts will be short and quick tips. Others will be deep dives on topics crucial to healthcare service, contact centers, or marketing. We don't believe the best patient experience should differentiate between education, marketing, and service. We're not just enhancing patient experience, we're fortifying our very healthcare institutions for a prosperous future. Today's healthcare must invest proportionally as much into patient service as Amazon and Apple invest into customer service. They should prioritize immediate responses, infuse empathy, and employ a patient-first approach. Gone are the days of the monolithic systems. The future champions adaptability, agility, and individual attention. This channel is about promoting the truth of patient service. So there will be interviews of those who have achieved success. If you're in healthcare and responsible for a call center or for marketing, subscribe to get new ideas, education, and checklists for patient access and service. If you're a healthcare executive or call center director, you may want to apply to our patient access community where you can meet and benefit from others who are passionate about developing the future of patient service. The pre-pandemic status quo was certainly imperfect, but it was familiar and predictable. Too many leaders are implicitly expecting those days to come back. We see them making small and timid changes, the kind that might patch things up temporarily until the good old days come back. Those not accepting the new reality, I fear, will be waiting a long time. If you're committed to immediate expert communication, holistic well-being, and the intersection of patient care and business outcomes, then you're already a pioneer in the new age of healthcare. I'm Stephen Dean, advocating for the future of patient-centered care, inviting you to the journey.